Hi everyone, my name is Makala Quinn, and this is my response to Professor Kerns' video on bundled payments. So first off, I'd like to thank Dr. Kerns for shedding some light and some insight on bundled payments. I found it very informative. I always thought bundled payments was pretty interesting. So I really enjoyed your YouTube video, Professor Kerns. Professor Kerns talked about how even though bundle payments have been around for a very long time, they've never really been widely implemented. So this is mainly due to the fact that really implementing these bundled payments would require a lot of change in workflow, in the workflow of hospitals. So overall, bundle payments I think are a really good idea. They allow people to just pay one central price for all the treatments they need, and overall it really helps the patient. So I really thought this was neat because when I broke my leg, there's just costs coming from all over the place. So from the surgery, but then you have to deal with the x-rays, and then you have to deal with physical therapy, and all these different people kind of talking to you and having bills come in from all over the place. I thought bundled payments would be really cool, especially in that case. So I thought bundled payments would be neat. But since it would require so much change in the hospital systems, so it'd be harder to track the patient, so you'd have to have someone in charge of just overall tracking the patient constantly through the process and finding out where all these payments are supposed to go to. So overall it just would kind of be more of a difficult process. So that's why they're not widely implemented at the moment. So I think there's definitely needs to be some kind of payment model for Americans to use for healthcare, something a little different, because as Professor Kerns said, we are very fastly going into debt and gaining more debt every single day. So there needs to be something that happens, and that needs to come through with a payment model. So when I was looking at the different payment models, I was looking on McKesson's website, and I saw a couple different ones. So there's like fee for service, pay for coordination, and then value-based reimbursement. So there are quite a few different ones out there, but the one I found most interesting was the value-based reimbursement. And this was because I kind of felt like it had the patient in mind. So how it works is it's like it's a payment model that offers financial incentives for physicians and hospitals and other healthcare providers. So it's not fee for service. It's more of, okay, well, if a patient comes in and this provider is counseling patients to stop smoking, they would get some kind of incentive to counsel patients to stop smoking, or maybe there's 5% of their patients lowered the amount of high blood pressure that they have, so maybe they don't have high blood pressure anymore. Stuff like that they would get incentives for. So I thought that was a really neat concept because like Professor Kerns was saying, Americans pay more for their health care, but we don't have the best access to care, and healthcare outcomes aren't the greatest as well. So I think that would kind of improve healthcare outcomes as well. So I thought that was a really neat concept. So not only would it give incentives to providers, but it would also, according to healthaffairs.org, it would actually penalize them if they had poor health outcomes, which I thought was a neat concept as well. So it's really giving them incentives to do the right thing and penalizing them if they're not doing the right thing. So I think overall this would really help with healthcare outcomes. So I thought it was a really neat idea. So overall, I think the bundle payment model would be the best, but is it the most easiest, I guess you could say, to implement? Definitely not. I definitely don't see it being implemented overnight. And according to the ACA, they're kind of slowing down the amount of bundled payments that they're doing. So I don't really see that it's going to go very far. So if we can't use this model, I think the next model we should use is the value-based reimbursement. But that's just my opinion. I thought it was really the best one for the patient and healthcare outcomes. So I thought it was pretty cool. But thank you again, Professor Kerns, for sharing your thoughts with us. And yeah, thank you. You guys have a great day.